Hello, and welcome to today's session on innovations in savings group programming for women's empowerment as part of the NGO CSW 67 Forum. My name is Dennis Mellon. I'm the Acting Senior Director for Gender Equality, Youth, and Social Inclusion at Global Communities. Global Communities is an international NGO that works at the intersection of humanitarian assistance, sustainable development, and financial inclusion, reaching millions of people with community-based programming in more than 30 countries to advance positive, lasting change in the Americas, Middle East, Africa, Eastern Europe, and Asia. For the past 9 years, I've worked on our global savings group programming, which we call Women Empowered, a savings group methodology which focuses on the social and economic empowerment of women. Over that time, I've seen the tremendous impact savings groups can have on the women and men who rely on them for access to financial services. I have also seen and been involved in designing and introducing innovations into these traditional community groups with the goal of advancing equality, inclusion, and economic access. This includes both digital innovations like smartphone apps designed specifically for savings groups, mobile money, and other digital financial inclusion services, as well as non-digital innovations that work to reduce barriers to participation, expand access and skills, and help create safer environments for women. It's with this broader idea of innovation around which we have organized our webinar today. And I think this fits so well with the theme of this year's CSW Forum. On Monday, I had the chance to hear UN Secretary General Antonio Guterres speak at the town hall with civil society as part of CSW. He noted the incredible advances and potential for inclusion and connection brought about by technological innovation, but pointed out that in many cases, technology has in fact perpetuated and amplified gender discrimination and has reversed trends towards gender equality. This digital discrimination is driven by biased algorithms designed by a male-dominated technology industry, relying on male-focused data sets, as well as by the well-documented digital gender divide. In addition to that, technology has brought new risks of technology-facilitated GBV, gender-based violence, and harassment, while also amplifying the voices of those opposed to gender equality, leading to increased risk of both online and offline violence against women. Now, technological innovation does absolutely have the potential to advance gender equality and women's empowerment, but it requires that we recognize the risks and barriers and be intentional about how we address them to ensure that the innovations do more good than harm. And there are many people, organizations, and technology companies working to do just that. We've brought together an impressive set of savings groups and women's empowerment experts today to talk about a number of the different innovations that they're working on and how they're helping to advance gender equality and women's empowerment. These are organizations that recognize the barriers and are actively innovating to address them. 2 notes about participation today. First, point out, you've seen on the slides, we do have interpretation available. If you click the interpretation button down below, we've got interpretation available in French and hopefully soon Spanish. And we will ask that you use the chat to introduce yourself, tell us where you're calling from, and throughout the presentation to add comments and ask questions, which we'll do our best to answer. Our program today begins with my colleague, Mabel Bejarano, who will set the stage for our panel discussions while sharing more about Global Communities' work with savings groups and women's empowerment. We'll then have 2 expert panels, the first of which will help to understand the context of savings groups and communities where we're trying to achieve gender equality and social inclusion and innovations in this space. The second panel will discuss specific solutions designed for a digital world and how we facilitate access for excluded communities. Each panel will include short presentations followed by moderated discussion. And with that, I'd like to introduce today's moderator, Julia Arnold, and then our first speaker, Mabel Bejarano. So Our moderator, Julia Arnold, is an economic and social inclusion professional with a strategic focus on women's economic empowerment. She is a research and learning consultant with experience in savings groups and livelihoods, financial and digital capability, social and gender norms, and digital inclusion. She led the Center for Financial Inclusion's Women's Financial Inclusion Workstream and led qualitative and quantitative research projects with ICRW's Economic Empowerment and Livelihoods portfolio. Julia is going to come on in a moment, and in a bit, in about 15 minutes, and she will moderate our panels. Before we pass things over to Julia, I'll introduce our first speaker, Mabel Bejarano, who is the Global Technical Advisor for Women's Empowerment and Savings Groups at Global Communities. Mabel has over 20 years experience in community development focused on the empowerment of women and girls, and recently returned to the US after 7 years based in Guatemala, supporting savings groups programming in the Americas and beyond. Mabel, welcome, and over to you.
Thank you, Dennis. And thank you everyone for joining this event. Thanks also to our fantastic panelists, the moderator who agreed to be part of this. I'll be sharing some of the savings groups innovations we have been working on at Global Communities in the last couple of years. So on my first slide, and I hope the birds around me are not too loud and you can concentrate on the presentation. Great. So savings groups are a small group of people who save together and borrow from their pool savings. And rough estimates suggest that as many as 500 million people worldwide belong to savings groups, which provide access to basic informal financial services in underserved markets. For millions of unbanked people in emerging markets, informal savings groups serve as their primary bank and social safety net. And this is particularly important for women. And so savings groups are widely promoted, as you may know, by hundreds of NGOs, funders, governments across 75 countries. That's the estimate in 2021 by SIP Network. It was estimated that there were at least 1 million of such savings groups worldwide, comprised of about 20 million members. So savings groups are also popular with farming cooperatives and merchant networks and are often started independent of sponsoring organizations. And savings groups provide members the opportunity to save frequently in small amounts, access credit on flexible terms, and basic form of insurance. And so these groups are owned, managed, and operated by their members, and they are by design financially and institutionally sustainable. They continue to operate independently after a training period of normally 9 to 12 months. And so over the last 30 years, the model has been adapted and adopted under different names, such as Village Savings and Loans Associations, Internal Lending Communities, or SILC, Savings and Internal Lending Communities, Savings for Change, self-help groups, community-based savings groups, and so on. And on average, each savings group manages total assets of about $1,200, representing an important safety net that supports low-income households to meet consumption, investment, and emergency needs. And so globally, 80% of members in savings groups are women. And so many programs are intentionally designed and implemented to narrow the persistent gender gap in financial inclusion, as you know. So it's through intentional efforts and innovations, such as the experiences that we will hear about today, that women have been able to overcome barriers to financial inclusion and participation. So innovations brought by savings groups to support gender equality and women's empowerment have vary from high tech to no tech, addressing social norms, financial capability, inclusion, and more. And so beyond financial inclusion, it's clear that savings groups are now promoted as an economic strengthening strategy for diverse development objectives related to livelihoods, gender equality, women's economic empowerment, health, social protection, water, sanitation, hygiene. This is because savings groups are a great platform for additional training and programming thanks to their nature. So on my next slide, I want to tell you really briefly about Women's Empowered. So Women Empowered is Global Community's signature village savings and loans approach. Women Empowered began in 2009 in Zambia and Ethiopia. And since then, we have implemented across 15 countries. And the program has been supported by various private donors and US government programs. The Women Empowered training modules integrate the development of human and social capital of women in vulnerable communities alongside the economic empowerment of savings groups. So develop and continuously refine over the past 13 years or so, the Women Empowering Initiative builds on proven savings group methodologies while also promoting capacity building and participatory group discussions that foster increased trust, social capital, self-efficacy, and individual and collective action planning. So Women Empower has a focus on women, clearly, and a focus on women's participation. We recognize that building our members' agency and voice is key to savings groups, members' social and economic empowerment. And so for this reason, Global Communities has built opportunities for learning and practicing these skills into savings and loans groups. And Women Empowering include also opportunities for leadership, public speaking, goal setting, problem solving, and also opportunities to learn how to collectively take action to address issues that members face in their communities and that are closely related to women's issues. And so the methodology also includes a male engagement strategy to help reduce barriers to women's participation and to help men see the benefits of including women in decision-making at home and also in the community. So on the next slide, I'll tell you a little bit about some innovations. We have worked in the past 4 years testing and launching various additional components to the Women Empowerment methodology, to the basic savings and loans methodology. And so while the We Savings and Lending work is focused largely on resources, such group creation, building skills and knowledge, savings, behavior, etc., and also on political engagement, a more holistic model of Women Empowered is focused on building women's agency and further increasing access to resources. So our innovations have been focusing on life skills, livelihood opportunities, and positive masculinities. We promote life skills through a professional advancement, career enhancement, or PACE program, a life skills methodology developed by GAP, Inc., and that focuses on the topics that I'm highlighting in this slide, and all of which are directly complementary to our Women Empowered core trainings. And we are also increasing livelihood opportunities through a basic business skills program developed in-house, and which was based on other NGOs tested curricula. We also promote advanced business skills through a more comprehensive program that addresses barriers facing women's ability to generate income. And finally, because many times the focus on women's empowerment challenges existing social norms around what are seen as acceptable activities for women or not acceptable, we work to shift norms to promote positive masculinities by addressing restrictive gender norms, promoting positive male engagement, improving couples communication, and preventing gender-based violence. And so we worked on a methodology called Journeys of Transformation, which was developed by Equimundo and was adapted to the Women Empowered context. And you will hear more about our collaboration with Equimundo and other experiences that have also challenged social norms and have engaged men later in this event today. So on our next slide, we have been able to gather important evidence from our project's evaluations. Next slide, please. And so here are some key themes that have emerged from these evaluations. So we have seen an increase in household income and assets, About 62% of members report increased income since joining a WE group in a project that we evaluate in Tanzania. We have also seen increases in social connections and collective action, also increases in livelihood activities and entrepreneurship. For instance, a program evaluation we did very recently showed that 53% of members use savings or loans to invest in new or existing activity. And then we have also, in terms of themes that are critical to women's economic empowerment, we have seen increases in household decision-making and communication, very important aspect of our work. And we have also seen a reduced acceptance of gender-based violence, in particular, reduce acceptance of violence when a woman disobeys a man or spends money without consulting him, for example, just to give you an example. And also in health and hygiene behaviors, we have seen skills gain to help improve personal hygiene at home and community, acquiring new practices, and we have many examples for this. You know, it will take me an hour to share. So finally, the evidence have also pointed to high levels of sustainability and replicability. We've seen, for example, a very large percentage of groups conducted on an evaluation that, you know, about 22% of those groups contacted were still active after 2 years of formation. So on the next slide, so while there have been huge leaps in access in digital technology, there still remains many women who are out of reach. So recognizing this and adapting to the needs of communities where we work, we have focused on ensuring inclusive training and delivery of our Women Empower approach. So in addition to the regular in-person Women Empower delivery approach, we have adapted to digital savings and are also adapting the Women Empower methodology to communities with very little or non-existent literacy skills. So we have an increased focus on low literacy by adapting Women Empower record keeping to oral cultures with the support of a leading expert organization called My Oral Village, who will be also presenting in the event today. We are creating a numeracy training in oralizing record keeping, such as the passbooks and the ledger books, and creating materials using pictures and icons and stories. And so, on the other hand, across the globe, savings groups are increasingly using digital solutions, and I'm sure you are very familiar with these, such digital ledgers and wallets. And this is done to manage group records and conduct financial transactions using mobile money instead of cash. So this leads to the emergence of digital savings groups, groups whose procedures, records, or transactions are digitized in some way, typically through the use of mobile phones and applications. So digital savings groups can also present the opportunity to be linked to formal financial institutions in the future. So at Global Communities, we began digitization of savings groups in 2019 in Tanzania using DreamSafe, which is a digital ledger designed by DreamStar Labs. And the evaluation of this pilot digitization project and the follow-on gender analysis conducted by Global Communities and Women for Women International in Tanzania, Ethiopia, and Rwanda revealed that digitization can have both negative and positive consequences for the ability of women and marginalized groups to participate in, to lead, and to benefit from savings groups. So digital transformation has the potential to accelerate benefits of savings groups for women by expanding their digital identities and bringing the gap to formal financial services. However, it may also help facilitate their participation in formal economy. However, Digitization happens in the world of persistent gender divide, where women's access and use of mobile technologies are constrained by very rigid gender norms and unequal power dynamics and limited resources. So on our experience, implementers that are not intentional about supporting women's use, the introduction of technology can have very negative consequences on gender equality and women's empowerment. So this is why we have created the Digital Savings Toolkit in order to inform and educate implementers and users in order to address those risks. So this is another innovation we have been working on. And on the next slide, I can show you really quickly. So as I was mentioning, our studies and experience led to the creation of this Digital Savings Groups Toolkit, which has 7 modules and which are aimed to informing and educating implementers and users to increase digital inclusion and capability in support of gender equality and women's empowerment. Each tool covers a topic which supports safe and gender responsive digitization to increase the benefits of digitization for women and to reduce risks. These tools are applicable across a variety of digital tools, such digital ledgers, digital wallets, cashless savings groups, data management platforms, etc. So I will show you now on the next slide where you can find this toolkit. So, and I strongly recommend you going into this link. So the past decade has seen, as I mentioned, a growing interest in investment in digital solutions for savings groups. And we know that each and every savings group, digital savings groups project implemented has generated a wealth of information about gender, inclusion, and many other aspects of digitization. So this information was not always easily available. And so to fill this vacuum, Global Communities partnered with the FAHU Foundation to create the DSG Hub, Digital Savings Groups Hub, a global destination for anyone who's planning and implementing, developing technology for and studying digital savings groups. Highly recommend you to visit if you haven't done so and to register. And so we designed the DSG Hub as an online learning and community platform aimed at facilitating effective, safe, and inclusive digitization of saving groups. And we have 2 main objectives. One is to share high quality resources that we can all learn from, and successes and shortcomings in the sector. And also the second objective is to co-create a community of practice so that a diverse group of stakeholders like you can connect, exchange knowledge, ideas, and even plant seeds for future collaboration. So we definitely invite you to join the hub and to share your thoughts. And so finally, on the last slide, we have learned so much from observing, listening from our projects, evaluations, from groups, from members, women, men, youth, from our staff. And so in terms of the promotion of gender equality and women's empowerment through savings groups, we've learned that what we are doing is working, but women do need more support in order to overcome barriers. So women still lack access to resources and opportunities to increase their skills and knowledge. This is due to social norms that limit opportunities for education, in part. Often also social norms restrict women's roles outside of the home, meaning they cannot work or start their own business or join a local a government committee, for example. We have heard time and again that women live under a constant shadow of domestic violence, physical, mental, and sexual abuse. And primarily, this is happening from their husbands or a family member. We have seen violence increase, as you all probably are very familiar, due to stresses of COVID and other emergencies. And the risk of violence increases whenever women do attempt to challenge norms that are holding them back. So we've also learned that what works to address these barriers is very related to the innovations that are presented today, and it's innovations which play a key role in helping women overcome these barriers. So I'm sure you will be learning a lot from our colleagues from today. I welcome you to share your thoughts in the chat. And thank you for listening to my presentation. And now I'm going to turn it over to Julia, who will lead us on to the panelists. Thank you very much.
Thank you so much, Mabel. That was excellent. Thank you, everyone, for joining. I am so delighted to be here with you all today to facilitate the discussions between our esteemed panelists on two panels. Before I introduce our first panel, just wanting to sort of piggyback off of what Dennis and Mabel have pointed out, that the context for this conversation is the increasingly digital world we live in, which all of us on this call are currently benefiting from and participating in. And we know that through digital technology, we are able to access information otherwise we would not have. We could access skills and opportunities to grow and change as people, economic actors, etc. And what's clear from Mabel's presentation is that the global community's approach to savings groups that have intentionally targeted women and created and designed products and services for them really bring out the positive outcomes for women in this space. But of course, as Mabel rightly pointed out, there are still many challenges. Technology, as with many other tools and services and systems, is not a neutral pathway. It has biases, and we have to sort of be intentional about how we ensure that anybody who wants to participate in the system has access, which may mean more effort and time on our part to build skills and change systems for different entry points for various people. So with that, I will introduce our first panel. Super delighted to be joined by these three experts. Next slide. Our first panelist is Melissa Wong Ogedo, who is the Senior Program Officer at Equimundo, and she runs the Journeys of Transformation programming, which engages men as allies in order to promote women's economic empowerment. Our next panelist is Hilawit Jebrahana. She is a Senior Technical Advisor of Social Norms at CARE USA, and she will be discussing how addressing harmful social norms to prevent violence against women can enable growth and economic empowerment for women. And finally, we have David Myrie, the Director for Partnerships at My Oral Village, who will discuss a particular marginalized segment, the oral communities, and discuss a solution they have introduced on oral information management for savings groups. So with that, I will hand it over to Melissa.
Excellent. Thank you, Julia, and thank you to Global Communities for organizing this event and for the opportunity to share with everyone our experience of engaging men as allies of women's economic empowerment. So Journeys of Transformation was initially developed in Rwanda between Equimundo and formerly known as Promundo US and CARE Rwanda and RUNREC to transform gender norms that limit women's participation in income generating activities. So in 2019, we began to work with Global Communities, who for over 5 years had been working with rural and indigenous women in Guatemala through their global initiative called Women Empowered, which Mabel described earlier on. So it was through this experience that Global Communities saw that restrictive gender norms that promoted and justified men's dominance over household decision-making and control over women's mobility, earnings, and assets were drivers of women's lower levels of economic agency, limited their participation in the saving groups, and also their ability to benefit from the economic opportunities that these saving groups offered. So while Women Empowered offered women the opportunity to access financial services and gain leadership skills, the initiative had no contact with men in the women's lives, and therefore was limited in addressing the gendered barriers that the women were facing. So over a 2-year period, Equimundo with global communities, we adapted, implemented, and tested journeys of transformation as a complement to Women Empowered. Can you please change the slide, Lizzie? So this is an overview of the program. The adaptation in Guatemala was renamed Caminos a la Transformación. And the program specifically targets the restrictive attitudes, social norms, and behaviors around more equitable and non-violent couples relationships that support women's economic empowerment. This is done through a 13-session program. 7 of the sessions work with men and women separately, and 6 work with both of them together as couples. And the methodology is gender transformative. It is designed to challenge inequitable gender norms and power dynamics through participatory activities such as role play, critical reflection, modeling, and practice of skills. Journeys of Transformation was implemented in 9 communities where global communities had active women empowerment saving groups. The majority of the participants were identified as Ladino and around 11% as belonging to a Hmong indigenous group. Can we change the slide? I'm going to take off the camera because I think it's cutting off a little bit. Okay, thank you. So through quantitative and qualitative research methods, we found several compelling results. Today, I'll highlight 3. So we found a significant reduction of the acceptance of intimate partner violence among men and women. And this includes the justification for the use of violence in situations where women break traditional gender norms, such as when she's considered to be disobedient or neglects the care of children. We also found significant increase of women's participation in joint decision-making regarding paid work outside of the home and how to spend family income. We also found a reduction in male dominance regarding women's mobility. However, we didn't find an increase in women's autonomous decision-making. And lastly, we also found an improvement in the quality of couples communication, where both women and men indicated significant higher rates of sharing concerns with each other and also being able to speak to the partner about whether to have sex or not. So from this experience, we have two lessons that we'd like to share with you. So the first is that interventions looking to promote women's economic empowerment can benefit from including gender transformative processes that target men, as men play a key role in limiting women's economic empowerment, but by shifting these restrictive gender norms, they can also play a key role in encouraging and enabling women's participation in the saving groups. And the second is that engaging men is also an opportunity to promote gender equality beyond women's financial inclusion. And this can be in the form of increasing decision-making regarding their lives, sexual reproductive health, improving the quality of couple relationships, and the reduction of intimate partner violence, overall contributing to greater female and family well-being. So that's it for me. So thank you very much. And I'll pass it on to the next speaker, Hilawit Gebrehana.
Thank you, Melissa. So I'll be talking about addressing social norms as an innovative strategy to prevent violence against women within in a context of saving groups. Next slide, please. So one of our programs that was implemented originally in Rwanda, Indashikirwa was originally implemented in Rwanda, and it was in a collaboration between Care Rwanda, Rwanda's main resource center, and the Rwanda's Women Network, and it was funded by the defeat Rwanda, and it was evaluated through a community-level randomized control trial that revealed the significant impact of the program that had on the reduction of intimate partner violence, mainly through the social norm intervention, which led to the adaptation of the program approach by partner organizations in Rwanda, Syria, Iraq, Lebanon, and DRC and Kenya. Next slide. So the industry drew on existing models, including SASA and other journeys of transformation. And there are 4 components of the program approach that were integral and supportive to the norm shift. There are community mobilization, opinion leaders training, creating women safe spaces, and mainly, which is the main component for the social norm intervention part, was the couples curriculum, which was formulated among couples groups of each member being minimum age of 18 years, and at least one partner had to be a member of the vessel or saving group. And there were 21 sessions that were conducted weekly with couples. Next slide, please. So, as I noted, the couples curriculum is the platform used to reflect and act on norms. And the theory of change of the program is premised on working to shift attitudes and behaviors at an individual and relationship level through building knowledge, confidence, and relationship skills, as well as shifting wider social norms beyond the individual level, and that underpin gender inequalities and the use of violence. So this couples group go through 21 weekly sessions over 5 months, and they reflect on foundational concepts of power and gender, rights, managing drivers of intimate partner violence, gender household roles and healthy relationships, gender intersectionality, and it also introduced activism and providing empowering responses to those experiencing intimate partner violence. For the norm program to be effective, there should be an opportunity to take action. As a result, we had take-home activities that been done, activities among couples. Next slide. So the impact of the Industry program was observed in 2 fronts. First, the women who participated in the couples curriculum reported a 55% reduction in the odds of experiencing physical and or sexual intimate partner violence compared to those who participated only in the VSLA or in the saving group. And similarly, among men, who participated in the couples curriculum reported a 47% reduction in the odds of having perpetuated physical and or sexual intimate partners compared to those group who were men who participated in the program but not in the couples curriculum. So demonstrating a huge difference between people who participated in the norm intervention versus who didn't participate in the norm intervention. Next slide, please. So to summarize the approach, the Indo model works with norm strategy in saving groups where couples are selected from existing saving groups and are recruited and go through 5 months of reflection and action on norms. And for the replication or adaptation of the approach, we recommend and we prepared a fidelity brief where 6 key designing components are important to be maintained for the program to be effective. The first part is working with couples, and then second is maintaining the power framework, where it explores how positive types of power within, power to, and power with, and negative types of power like power over. And that helped a lot among couples to identify multiple forms of intimate partner violence and move beyond the typical binary of men as solely perpetrators and women as victims of intimate partner violence. And third, it's important to maintain the sexuality content and focus on sexual consent. So though this discussion towards this taboo concepts and taboo issues is difficult among most cultures, it's integral to shifting the norm in the core part of the indie. And finally, it's about having an explicit next step after the curriculum ends, which is mainly what I said about action and diffusion of changing norms. Yeah, thank you so much. And now with that, I will hand it over to David.
David, you're still on mute.
Yes, I did that. I'm hearing some background noise too. Yeah, thank you, Hilary. That was a great presentation. Greetings to all. I'm very happy to be able to share today some insights and tools from collaborations that My Oral Village has with people who cannot read and write one-digit and multi-digit numbers. I'd like to ask all of you for a favor. Could you just take a few seconds now to imagine what challenges you might face if you were a rural woman unable to understand financial amounts and dates written on a paper or a screen? Just take a few seconds. Okay, perhaps you would have doubts that the shares you purchased in your savings group or that payment of your daughter's school's fees you just made at the bank in the nearby market town have not been recorded correctly. An estimated 1 billion adults must live every day with exactly this kind of worry. They stress out about whether their hard-earned money is being accurately handled by savings group record keepers or bank tellers. Next, please. We found that, next, please. Sorry, go back to, apologize here. I'm actually not on the right screen on my other computer. You should be on the second slide, Lizzie. Thank you. We found that, the second slide, we found that a majority of poorly schooled adults can count cash accurately, but cannot write down or read the amounts they count. They capably operate in local markets that are characterized by personal, immediate exchanges of banknotes and coins for goods and labor. These are oral, not text-based communities and people. But the skills of these oral people in using physical cash do not easily translate into carrying out long-term savings and investment plans. Such planning necessarily requires the ability to record financial transactions, not just in the here and now, but to track them over weeks, months, and even years in rows, columns, and cells of their passbooks, ledgers, and calendars. We aim to build financial numeracy, which we define as the possession of the numeracy skills required to carry out financial transactions with understanding in real time. It includes the ability to read and write large amounts and to plan cash flows in calendar time. Next, please. A question: without financial numeracy skills, can people truly be fully financially included? Women are about 2/3 of the financially innumerate, so a lack of financial numeracy is a major obstacle to women's economic empowerment and for their financial inclusion. It also blocks progress towards gender equality more broadly. To support the quick acquisition by people with low or no literacy and numeracy capabilities of these useful financial numeracy skills, My Oral Village employs a collaborative design approach we call Oral Information Management, or OIM for short, that our founder, Brett Matthews, has pioneered. After training by us, our partners sit down with savings group members, as Global Communities has been doing in South Omo, Ethiopia, to explore how they handle money. The women identify images which they feel can represent financial activities, such as making share contributions or loan repayments. In their old passbooks, text is replaced with images, in effect, making them understandable by women who cannot read or write words and numbers. Next, please. The capability to identify and write the digits 0 to 9 is the key that unlocks numeracy through OIM. Around 90% of the women participating in Global Communities Women Empowered Savings Groups in South Omo could not read and write one-digit numbers at baseline. The women's first step in reducing that percentage of innumeracy is to jointly teach themselves how to read and write one-digit numbers. A number log is distributed and the women practice together to count quantities of objects and write down the corresponding numbers they obtain. For example, if a woman owns 5 goats, she can map each goat to a stone on the log. She learns to represent the 5 goats with 5 stones and then associate the written number 5 with that quantity. Once a poorly schooled woman has learned to write one-digit numbers, she can begin keeping records that represent multi-digit numbers, as we will see now. Next, please. A number frame, what you see pictured here, is a paper-based OIM tool that can be embedded in financial records, such as passbooks or ledgers, that enumerate savings group members can use to record large financial amounts. The women in South Omo decided that a hen can represent the concept of loan because it embodies the small income generating investments they commonly seek to make. Running along the top from right to left are, so I'm getting feedback. Running along the top from right to left are icons representing Ethiopian currency worth 1 birr up to a bundle of 10 100 birr notes representing 1,000 birr. It's roughly 50 birr to $1 US. An unschooled record keeper can write the amounts in the cells above. Say she has been in hand 2 100 birr banknotes and 5 10 birr banknotes. To record that amount, she counts the number of 100 birr notes and writes a 2 under the 100 birr icon. And similarly, counts the number of 10 birr notes and writes a number 5. Having no 1 birr coins, she adds a 0 under the 1 birr, thus generating the total that she has in her hand of 250 birr. Using this OIM approach, she can keep the records for herself and for her savings group. Next, please. I'm out of time. I'm not going to read this, but the most important thing is I'd like to share is the third bullet point there. OIM can help bolster gender equality in that we found in Kenya, the participants who used it expressed a strong interest in continuing to improve their numeracy and record keeping skills. The women saw a path forward and want to follow that path. So this will help them remove one of the many barriers they face to achieving gender equality. And we hope that this same enthusiasm, and we're already seeing it, in fact, in South Omo, will further develop and persist. Thanks for your interest. Over to Julia now.
Thank you, David. Thank you, panelists. That was excellent. I think what I find really interesting is the what can be achieved in the group and household level with these kinds of efforts and curricula. So layering on top of the savings groups to address some of these systemic barriers can really yield significant impact. I was hoping to pull out just a little bit from that sort of household level and community level and talk a little bit more about some of the systems changes and normative changes that need to happen in order to create sustainable long-term equity, empowerment, and inclusion for marginalized populations, which includes women, but also the oral communities and others who typically join savings groups. So Melissa, from your perspective, what are some of those systems and normative changes that need to happen?
Yeah, so I'm gonna keep the camera off because I think the internet is really unstable. But when we're talking about sustainable long-term empowerment and inclusion of marginalized populations, we need to consider that people's marginalization is a result of global and national economic structures designed to benefit some and that support other systems of oppression, such as patriarchy and racism. So these are all sort of held together by policies, they're implemented through institutions, and then they're also justified through social norms. So I think that we need to work on all of these levels through an intersectional rights-based and relational approach, where the systems of oppressions they're all considered, because it won't suffice to only change policies when social norms continue to support the subordination of women. Likewise, it doesn't make sense if you change norms among the marginalized populations with these programs and don't actively ask for change at the institutional level to include them in financial opportunities. So apart from this, and maybe more broadly, I also think that for rural and indigenous groups, who are probably the most marginalized populations in the world, for them to be able to thrive, we also need to radically shift the way that we extract resources within their territories and actively address climate change, as both of these are directly affecting their ability to survive, let alone economically prosper. So I leave it there for somebody else to also contribute.
Thank you, Melissa. What I heard was all the systems need to change. Hilawit, from your perspective, working with CARE, are there any specific systems that you are currently sort of targeting with any change in mind?
Yeah, so I agree with Melissa. I think it's more of a holistic change, a holistic approach is important for any change to appear. But the focus comes in depending on the focus of interest or topic of interest we're working on. And one thing I would emphasize here, however, is the informal systems, the informal rules and regulations that exist in communities are sometimes much more stronger than even existing formal structures and systems. And that's why we are trying to work on, or at least expand our focus on social norms shifting. So it doesn't only promote or change a specific behavior, but also it addresses, when you work on social norms, particularly meta norms, usually you target interlinked behaviors. Hence, it's much more sustainable, and it's also effective in hitting all the targets you wanted to hit just with one approach. But here, it's also important to recognize that shifting norms is not as easy shifting attitudes or knowledge, because it's not only about the one individual or how many individuals we are targeting. It's also about all the community. And as I said, it's unwritten, it's untangible, it's difficult to identify and prioritize and target. And also it's important to make sure to recognize it takes longer than it would have taken us to change other things when it comes to norms. So we need to create focus where it's difficult to create. So we need to identify which are the meta norms we wanted to change, which are the proximal norms that are very close to and proximal or immediate to the topic of interest. For instance, for IPV, which is the most important norm we want to focus on, is important. That's why we do reflections with communities. That's why we do formative research. That's why we do action planning and implementation and monitoring and all of that. And even though it seems tricky and very challenging, I think it's possible and it's sustainable to do to provide focus and to provide attention to the informal structure, social norms. Yeah, thank you.
Yeah, thank you. I would say that not only is doing it sustainable, but in order for sustainable change and equity and inclusion, it is necessary. And by focusing on, as a project or an implementer or donor, the norms that you want to focus on, it makes it a little less panic making when it's every system needs to change. Yes. David, same question for you. Particularly from an oral community, since that's your expertise perspective, what are some of the systems that you at My Oral Village are focusing on shifting and changing?
Well, I think that one of the most important norms that needs to change is that adults cannot learn new things after a certain age. We see a lot of this about, women have been excluded from access to education historically, and and men too who are poor, and there seems to be an attitude, well, you can't learn numbers. Numbers are really complicated. Think of how many years we spent in primary school learning how to do our addition and our subtraction before we started multiplication and so on. And so there seems to be this idea that numbers are just beyond people's reach. And that's just the way the world works. We actually see that and hear that a lot. And I think we need to challenge that norm. That norm holds back a lot of people, a lot of women, and they're being, and it's not only that they aren't able to do as much as they could, that they have the potential to do, but also really makes them very vulnerable to fraud. And those of us who work in this area know that consumer protection is relatively underdeveloped in savings group because the idea is we're part of a group, but power relations exist everywhere, not just between the rich and the poor, between men and women, but among peers.
Absolutely. That's so true. And yes, we can teach adults new things. Let's send that out into the world. We have a question from someone in the audience. What is the perspective on ensuring new service systems intervention or intergenerational? So what I like about this question is, we can talk about adults. We're serving them in our savings groups. They're typically at least 18 and up. I know some organizations like CARE do target youth. But that intergenerational, there are certainly older folk, my grandmother and the grandmothers here in Rwanda, where I'm currently, who hesitate, who may find some of these new information or changes in the household to be nerve-wracking. So I'll just throw it to Melissa, Hilowit, and David, whoever wants to pick it up, if you have any perspective on or evidence on intergenerational systems change.
I can address this very briefly by saying that while we believe that young people going through the education system learn numeracy skills, and they generally do, it's also interesting to see that that generation sometimes doesn't gain them. And I think we're about to see a lot of evidence of that because of the COVID shutdowns that so many young people experienced that disrupted their education. We know that in countries like Uganda, schools were closed for well more than a year. What are the impacts of that to be dealt? But the other thing that happens is that you build those skills up, those numeracy skills, but then you're in an environment, a context where your daily economic lives are such that you don't use numbers. And you can forget, just like we can learn, we can also forget. And so our methodology of OIM does try to target that by creating something that's accessible. And one of the things we try to do with the tool is to make it so that it's comfortable for literate and numerate people to use too. That it's transparent to both the innumerate and the numerate. And so I think that that's going to be a big challenge for all of us to find in the next couple of years, the impacts of COVID on the youth.
That's true. That's true.
And also, just one last point, while literacy's gone down in relative numbers, relative percent, it's still the same absolute. It's still well over 1 billion people. Hasn't gone.
Hilowit, because you're with CARE, and I know CARE focuses to a large degree on enabling and utilizing actors within the existing marketplace and enabling them to create sustainable long-term change. I'm wondering, what is one critical thing that you think stakeholders on the supply side as well as the demand side need to consider before rolling out a digital solution or other innovative product for savings group?
Yeah, I would say recognizing that all the problems we like to resolve exist in a social context. It doesn't exist in a vacuum. So just understanding that would help us, like, what are those social factors that we want to work on before we launch this innovative product for it to be effective. So even if the technology we're using could be through phone, even if there's access, even if it seems like everybody has a phone, does everyone has equitable access to the phone in the household? all these things can be broken down and understood only if we are able to look at the social factor, particularly the norms of how households operate, how communities operate. So I would say for both sides, if we approach programs and technology adaptations from that angle, as much as we pay attention to how efficient the technology is, it increase the adaptability, the usage, and also the result and impact of that component or program. Yeah.
Thank you. Yeah, I'm hearing a pretty consistent theme about programs, implementers, any stakeholder really thinking through those social systems that they are interacting with within their program, and really being very purposeful in engaging them and understanding them and embedding them in their project. Melissa, I want to bring you back in to this conversation, and I'm going to throw another question at you. How do we identify and implement the right tools and products for savings groups that have the potential to increase equity or inclusion and minimize the risks of marginalization or even violence?
Yeah, so in order to identify and implement right tools, I think it is key and necessary to listen to the people that will ultimately use the tools or be served by the tools. Ideally, the tools can be co-identified and developed with the communities, and they can also uphold and recognize their prior knowledge, values, and motivations. It shouldn't be something that's imposed on the people. So more specifically, when we design tools that look to engage men as allies in women's economic empowerment, it is also important to be intentional about this work. And I know other people have said this in the presentations. We need to identify the social norms that are present in the location, what is locally accepted as for men to be, to do, to act, to think, to practice, what is locally accepted for women in that location as well. And then try to target these things, because we have said, yes, it is a lot of systems, and yes, there are a lot of factors. So if we focus on women's economic empowerment, there will be other factors that also limit and affect their life, their work. You know that violence is a huge issue that limit women's economic empowerment. So by targeting all of these together in a sort of holistic way that looks at power dynamics and that also supports people. People are not, they're not naturally evil and want to be violent against each other. We believe that a lot to do with the restrictive social norms that have taught us to be this way in order to survive. So I think building that community, that sense of feeling, that sense of connection, it works a lot when you do this with couples. So that helps to prevent violence, that helps to improve the relationship. It helps for health outcomes as well. So that would be that would be the sort of approach that I think would be useful in identifying these tools.
Melissa, I have a follow-up briefly. The idea of targeting couples or households to have these conversations, we know that works. We have data that show that works in terms of behavior change and long-term change within a household. It is a little overwhelming for many stakeholders to think about going household to household and having those conversations. And I'm wondering if through your experience with Journeys of Transformation, you can speak to that worry, or if you also have any examples of ways of doing that kind of targeting that are I'm going to say simple to implement, but that's not really what I mean. But yeah, that kind of get at some of that concern.
Yeah, so our couples work, it's not door to door in their house. So they're actual group educational sessions. So you're kind of, if you're thinking about cost benefit, when we're thinking about scaling up, how effective and efficient are these programs? group educational sessions between 12 to max 15 people. We know that that also works, not just with journeys of transformation, but other group educational sessions. I wouldn't say something bigger than that, because the aim for this, and by using gender transformative approaches and methodologies, it's about creating a space for people to come together and start questioning the gender norms that they have been raised up to hold and to believe. So if you have a large group of 100 people, it's a little diluted. Around 50 it seems to work, maybe around 20. I know another program are trying to do a bit more like bigger groups, but I think we are also in this digital age, we're also trying to see how can we get to people and how can we create those environments that promote the questioning of the beliefs through different means, because we do know this is also restrictive. In urban areas, it's more difficult to implement group educational sessions than in rural. So how can we target those populations? It's questions. I think we're all trying to experiment with different ways, and perhaps the next panel can also contribute to that with their experience. But yeah, I think we're all trying to learn what can work.
Yes, it's true. So that wraps up our time we have for discussion with panel one. I want to again thank Melissa, Hillowit, and David for their time and expertise. Lizzie, we can go to the slide for panel two, where we will discuss designing solutions for an increasingly digital world, facilitating access for excluded communities. And our first speaker is Bindi Javarhi. She is a senior technical advisor for the financial services team at Grameen Foundation. And she will be discussing refugee finance, building and enabling digital financial service ecosystem for refugees, I believe in Uganda. After Bindi will be Nima Saho, who works with Vision Fund International in Tanzania as the FAST product manager. And she will discuss the financial acceleration and linkages between savings groups and formal financial institutions. And our final speaker today will be Rachel Boketa, who is a country director of the DRC Women for Women International. And she's going to talk about health insurance and savings groups, which I'm very much looking forward to. So Bindi, over to you.
Okay, thank you, Julia. And I'm just going to turn on my camera for a second so you can put a name to a face, and then I'm going to switch it off so I can go through the presentation. But my name is Bindi Javarhi, and I'm going to be speaking about our refugee finance program in Uganda, which builds a more enabling financial services ecosystem for refugees, especially women, to access financial services for business growth. So you can go to the next slide. So Grameen Foundation is a global nonprofit that transforms ecosystems to allow women to claim their full power. And we do this primarily through digital financial services, digital agriculture, and women's economic empowerment activities. And underpinning a lot of our programs are digitally enabled community agents who are mostly female. Next slide, please. So Grameen has been implementing our refugee finance program in six refugee settlements in Uganda since 2019. And before I talk about the program, I really wanted to talk about the barriers that refugees, especially women refugees, face to using financial services to grow their businesses. So to understand these barriers, we used a basic market analysis that investigated the supply and demand barriers and facilitators to access and uptake of financial services, and a multi-dimensional gender analysis that looked specifically at the gender-related barriers that women face to using financial services and being financial services agents. So next slide. So basically what we found is refugees face a multitude of barriers to accessing finance, and it's even worse for women, which is not really a surprise to any of us. But to look at the barriers that refugees face in more detail, first looking at the supply side from the side of financial institutions. Financial service providers like banks, microfinance institutions, and SACCOs are really reluctant to offer financial services to refugees because of perceptions that refugees might be risky clients or they might leave the country at any time. And financial institutions we talked to just told us that they just don't have enough information and data on the refugee market to be able to comfortably provide these services. So there are some financial institutions that are open to serving refugees, but they haven't been able to expand beyond a small area. And so as a result, refugees face long distances to access formal financial services from those institutions. So digital financial services offers a way to link refugees to financial institutions that are willing to serve them. But we found in the refugee settlements that we're working in that there's really limited digital financial services agent networks. Then looking at the demand side, most refugees aren't able to qualify for individual financial services because they lack identification documents, they don't have land, so they can't use land titles for collateral, and they don't have formal credit histories. At the same time, there's low digital literacy. So refugees, if they had some more digital literacy, they could potentially use the digital financial services to access faraway financial services, but it's really low. And our analysis found that women are even less likely to be able to do a simple transaction on their phone. There's also a lot of language barriers. You can imagine a refugee coming in from Somalia, the Congo, South Sudan, coming into Uganda. They don't speak the language in Uganda, any of the languages, and they have trouble even, talking with agents or financial institutions. At the same time, finally, refugees, they don't necessarily know what products are available in their local communities. I think you can picture it from their perspective. They just moved to Uganda. They don't have anything with them. They have barely the clothes on their back. They're in a place where they don't speak the language. They're really like a fish out of water. And so, of course, they don't know what financial services are available to them. And they also often believe that refugees don't qualify or aren't allowed to use financial services. So there's a lot of barriers, and women in particular face heightened barriers compared to male refugees. So what we found is refugee women often have lower levels of education and are more likely to be illiterate than men. So it makes it nearly impossible for them to use digital financial services or even regular financial services without some sort of helper or agent. And so from the Grameen Foundation perspective, we saw that expanding women's digital financial services agent networks could resolve a lot of these issues that women refugees face. But women, in fact, face barriers to becoming digital financial services agents, especially refugee women. So they don't have startup capital. Their spouses often forbid them from becoming agents. They have limited time available due to heavy household workloads. And and of course, they have difficulty getting business registration and other things because they're refugees. So those are some of the barriers that refugees, especially women, face, and we can, come to the solutions that we identified and we piloted. Maybe next slide, please. So we basically designed our refugee finance program to address the barriers that we saw and build a more enabling ecosystem for refugees, especially women. So our approach is really market driven, and we pull in private sector actors. So we pull in private sector financial institutions, fintechs, clean energy providers, and other private sector actors to provide services to come into the refugee settlements and also provide services that meet the needs of our refugee clients. Basically, you can see the diagram here. The foundation of our program is savings groups composed primarily of women. They're 77% women. And what we do is we digitalize the savings and loan records of the savings groups to form alternative credit histories. And we work with our partner, we identify and work with partner financial institutions to use those records to deliver group loans and group savings accounts to the groups that we're working with. And so why are we focusing on group loans and group savings accounts? Basically, the group financial products enable refugees that wouldn't qualify for individual loans because of all the things I mentioned before to access formal financial services. And the terms and conditions of the loans, so the way the group loan structure works, which I know our next presenter is going to talk about, are more flexible and allow people to take loans in different amounts. And so those loans really better fit the needs of refugees who might have limited economic activities but still need finance. And finally, we also work with MTN Uganda to establish women and youth digital financial service agent networks in the settlements that we work in. So we try to address the different barriers, the gender related and the market barriers that prevent women and youth from becoming agents. And then we establish those agents with MTN. So it really builds an infrastructure for digital financial services access in the settlements. And then lastly, just like David has been talking about, we focus on digital financial literacy because we recognize that people are not going to use DFS products without digital financial literacy. And I'll talk just very briefly on our results to date. Next slide, please. I just put in a very high level listing of some of our results. So key results are we have worked with over 12,000 savings group members in 6 refugee settlements in Uganda. We have digitalized over 7,000 and we have linked over 6,000 to group savings accounts. At the same time, our women and youth agents have completed transactions worth over 800,000 USD. And we found that our women and youth agents, in addition to providing financial services and digital financial literacy services in the settlements, they're also earning good incomes, which we're very excited about. So what we found is that our average agent with at least one other income generating activity earned a total of 280,000 Uganda shillings per month. That's 21% above the average for people in that area. And mind you, that's just at the 6 months into their business, we looked at the incomes. And at the same time, the agent business accounts for 75% of their income. We surveyed the agents and we found that 100% of our agents intend to keep their business going for at least 20 years. So we saw a lot of success around expanding access to financial services, as well as building incomes for women and youth refugees. That is everything. So thank you. And I'll pass it over to our next presenter, Nima from Vision Fund International.
Thank you, Pini. Okay, hello everyone. Allow me not to switch on my video due to a network issue. I'm Nima Shayo, I'm from Vision Fund. I'll take you through how Vision Fund managed to facilitate access for finance to the excluded communities. For more than 10 years, Vision Fund has been working to support a community savings group using different type of loan products. As we all know, savings group are owned and managed by members themselves, and their simple transparent method amount into cash, a small amount of cash into savings. So, and in most areas where Vision Fund are working, community are living too remote, and most people are living below the poverty line for banking to meet their needs. So in that area, savings group fill in the gap that's left by the formal banking institution by giving the member access to financial securities. So you may ask yourself, why first? After the second cycle, saving group are matured and their savings become more strong. Also, their income increases. So in that case, what they save in internal could not meet their demand. So in that area is where first chip in by providing loan to the matured savings group. Next slide, please. So the first product, it's the loan size. It depends on the previous group share out. In most cases, the group will share out after 12 months, and we are providing 50% of the share out amount. and the interest rate is different from one country to another, but in all area, it's supposed to be more, it's supposed to be less, more than what our interest rate. So if the group has interest rate of 10%, our interest rate should be more than 10%, so that they can be able to get the profit out of the loan we are given. And our loan product durations are 3 months to 11 months, and the group has to pay back before they share out. That is, before they share out what they have accumulated for a period of 12 months. And the loan criteria is 12. A group should be mature, that is, should have 2 cycles, that is 24 months or 2 years old, and the rotation rate should be 85%. This rotation rate we are measuring using our system, but also the group should have a good record keeping, include the passbook, group ledger. They are supposed to be all in order. And all the group member, that is 100% of the members, should agree to take loan, and majority of the group people they're supposed to have a business to invest so that they can be able to take loan from Vision Fund. Before giving the loan, we also provide with the education. We call it embedded education, borrowing wise for the new group borrower, but also for the repeated group, we are giving them women economic empowerment training. And the group should pass all the group verification tests, but also a group who are supposed to take first loan, they're supposed to be referred to us by the partner NGO. Like nowadays, we are partner with different NGO, but also our monthly payment is in monthly basis, where they're supposed to pay principal and interest. Next slide, please. So in address gender equality and women economic and women empowerment, Vision Fund make a first loan to be pure group loan, and it differs from other loan products. The first difference is that this group or savings group are supposed to be referred to us by partner, but also the product is more digital, paperless, and cashless, and that it is loaned to their cash box. And staff who are given this loan, they're coming from far from our branches. Most cases they are from the area where group are formed, and also onboarding or recruitment process is through assessment and not interview like other products. Next, please. So when we are saying it is through group loan, we mean that a loan is given to the group via mobile money into their cash box. So we are analyzing group capacity, not individual business. And the field officer who are staff responsible for giving loan to the group normally do monitoring to the group during their group meeting place. Means that group member or group leaders are not supposed to come from their area or from their location to our branches, since the product is more digital. And the group interest rate, as I mentioned before, is supposed to be higher than that of Vision Fund, so that the group can get profit out of the loan. But also our system is capture data on the group basis, that number of the group member, number of female, and also children who are going to benefit from this product. Next, please. This loan is more is digital. This loan is digital, and we are using the ODK Open Data Kit, where we have formed the group verification, loan application, BM checklist, where we collect this using ODK, and then we managed to generate a PDF form from the ODK server by our customer service officer. From there, we make a review, then the field officer supervisor are going for physical verification to the field. Then it sends a form and it sends a form, it also downloaded it, and our branch manager be able to review it and make a decision on whether the group should be given loan or not. But also all this process is more digital, like I said before. Next, please. Also, since it is a digital, we doing monitoring on the how our field officers are doing their work using Power BI. And under this, you see we have zoning field officer according to their location. So we're reducing the distance from one area to another. Thank you. Next, please. Time is out. The last one on impacting. From the last year, we managed to increase the share out of the group who are taking loan from us, but also 91% of the clients report that their quality of life have improved after taking a loan from Vision Fund. Thank you. Okay,
Thank you, Mima.
Welcome,
Yeah.
Rachel.
Go ahead, Rachel.
Thank you, Nema. I would like to first say that our group savings, VSLAs, as we call them, are also transitioning to be digital, you know, just to link up with the thematic of the panel. But for the sake of this presentation, I will focus on micro health insurance as a way Women for Women International has been using, you know, to allow access or to support access of those marginalized women that we serve to healthcare as they live in those areas where there are two characteristics when it comes to service provision. One, it's scarcity, and second is costly. Next, please. So Women for Women International, who we are and what we do, our vision is to create a world where all women determine the course of their lives and reach their full potential. As you know, we work in those countries affected by conflict and war, and we support the most marginalized, like I just said, to earn money, improve their health and well-being, and influence decisions that affect their lives and communities and the household they live in. And we also support them to connect to network, you know, for support. Women for Women International, we are not a direct service provider. That's why partnership is key for us. So we implement our signature program, the Stronger Women, Stronger Nations, through a 12-month graduation approach, which has two main components, which is economic empowerment, that provides training, including the setting up of VSLAs and vocational training. And the second leg of the program is social empowerment training that includes women's rights and health. Important to underline, as I heard from previous presentation, that we also use men engagement as support to women's empowerment. And also we have change agents, which are those women that graduated from our program, but they are still in community to help build capacity of the others and get others enrolled, mobilize community around issues related to women's empowerment. So this is for sustainability purpose. And what we do is we connect those women we serve or the women in the community to providing basic health information and referring them to nearby healthcare facilities. So why is micro health insurance so important in the DRC? I would like to say that, you know, DRC is one of the poorest countries in the world. It is ranking 164th on the 2020 Human Capital Index and 151st on the 2021 Gender Inequality Index. So you see, in that context, and given the high costs of healthcare, those women marginalized, vulnerable, which live in the context that I've just painted, cannot afford a healthcare facility. And we did an analysis that proved that. So as we are not a direct implementer, like I say, and our organization's main outcome is improved health and well-being of women, we found in the study I mentioned so numerous barriers to healthcare that led us, to support the micro health insurance. Besides, there's higher maternal mortality rates and lack of access to primary health care. And, this is due to quality of the service that is provided and the cost. Next, please. So our approach, how can I maybe briefly describe it, is first, we have agreements that are developed and signed between healthcare service providers and VSLA group. Like I said before, we are not a direct implementer, so we facilitate that. And we help them negotiate a low-cost option to support women's agency. VSLA group's members contribute in their group social fund, which is held within the group, and during each month where they have their VSLA meetings. So prices are negotiated upfront with healthcare provider and their locals. So consequently, there is no charge at the point of service of VSLA group members or their dependents, eligible dependents, be it spouse and the kids. We have focal points in VSLAs, which are elected by themselves to represent VSLA group in healthcare providers. So when services are needed, group member and their family are linked to healthcare providers by those focal points. And we have found that from our evaluation that group rates are slightly less than individual rates. The scheme also covers VSLA group members, immediate dependents, like I said. So we piloted this program between 2020 and last year with the support of the McLean Foundation in 3 communities in South Kivu, which are Birembe, Burini, and Luchiga, and 1 community in North Kivu, which is Rubaya. Next, please. So these are results so far from the pilot. So as you can see from the slide, there is 577 people who received medical care due to the microinsurance program. And of this number, 294 were members, direct members of the VSLA, and 283 were their eligible dependents. So healthcare service providers also provide session, awareness raising, and call community mobilization to enroll in those. That's for expanding the model. And the session topics were around hand washing. As you know, it started in 2020 with the COVID, family planning, prevention of sexually transmitted infections, food hygiene, nutrition during pregnancy, and breastfeeding. Because these were identified like one of the key areas where women are in danger for their health. That's from the study I mentioned in the beginning. So we collected one of our participant quotes during the final evaluation of the pilot, and I quote what she said: "My 3 children, my husband and I were interned at the Earth Center of Iambira several times. If I were not a member of VSLA supported the micro insurance approach, we would have had to sell our harvest and our only goat, which is the wealth of our family, you know, in order to pay for all these medical bills and healthcare, you know, costs. So thanks to the support of the VSLA group, we are able to receive treatment, and we have protected our crops and goods. So you can see what this small intervention, maybe at very grassroots level, can have on women's life, those beneficiary to our program. Next, please. So I will conclude by saying what we have learned so far. As you know, there was a challenge because, you know, in any community, you know, which is where services are scarce, there might be problem around like sticking to the agreement. So the agreement between those VSLAs and healthcare service provider were not always like observed, you know, and respected. So to address that, the focal point, VSLA members were able to meet with the service, you know, to demand for the agreement to be respected. So that's how it has empowered them. You know, for those women who did not have like access to, you know, which voice could not heard, but then they could demand for the agreement to be respected. And therefore, VSLAs needs to be encouraged to monitor and enforce agreement with healthcare providers. So when this approach was introduced to women, they see this successful model and use it as a tool to self-advocate and engage in improved health-seeking behaviors. So which is like something we want to expand in other community. And speaking about next step, we want to scale across other VSLAs, because remember I mentioned only 4 communities where we pilot. And we also want to integrate that into our signature program, in our standard model. And we want to make it sustainable, meaning we would like to support VSLA to be able to renew agreements and negotiate those agreements on their own without Women for Women International involvement. I think there's a lot to say on this, but for the sake of the time, I might stop there and hand over to Julia.
Great.
Thank you.
Thank you. Thank you so much, Rachel and Nima and Bindi. Those were great. In the interest of time, we have run over our allotted time, but I do have several discussion questions, and I will stick to just one per panelist for those who are free to stick around. Please do stay. So Bindi, I want to start with you, linking back to the previous panel and a question around digital solutions for savings groups. I'm interested in your experience and Grameen Foundation's experience. What's one critical thing that stakeholders, implementers, need to consider before rolling out a digital solution for savings groups, particularly for refugees?
Okay, Julia, I might say more than one thing because there's always the one most important thing, but I'll say it quickly. So, you know, when we roll out a lot of digital solutions through Grameen Foundation, and I also see the digital tools that other partners and implementers are rolling out. And I think the first thing people need to remember when they're entering this digital space is to put the needs, preferences, and constraints of your clients at the center of the digital solution that you are rolling out. Because, you know, make sure the digital solution meets their needs and addresses their challenges, because they're the ones who are going to be sustaining that solution after you leave. And if it has no benefit for them, they won't sustain it. I think that people also need to consider the costs and willingness to pay of your clients for the digital solution. We see so many solutions rolled out that even, you know, maybe more costly than they're worthwhile for savings groups or actors. And we see a lot of cases where clients don't want to use something that, you know, makes them use the internet so much, like, you know, like video-based tools. If they have to pay for internet services, they might not watch those as much. The last thing I'll say is just travel to the field and meet end users of the solutions you're considering. You know, sometimes these solutions sound good on paper and the people who are talking about them can be very convincing, but you won't really know if they work until you meet the groups in the field and hear what they say. And it can often be quite different.
Absolutely. Those are quite excellent insights and experiences. Thank you, Bindi. For Rachel and Nima, I'm interested, so many questions, but I'm interested in the recommendations that you would make for other stakeholders interested in implementing a program similar to or like micro health insurance or a FAST in another market. What's a key lesson or two that you might suggest for these innovations? Rachel, we'll start with you.
Okay, so I can say, you know, we are amending our strategy for the upcoming 5 years. So one of the way we would like to expand is through partnership. So for us, you know, getting more people to use our approach will be for us a way of expanding for that model. So that's I would like to put first. So what I would encourage those organizations who would like to embark on the journey is to learn from us, to join us, but context matters, you know, so they need to do an assessment of where they were, available services and way of, you know, implementing that correctly so that it fits within the beneficiary and the targeted population. So I will stop by that. Like, partnership is key, partner with us, and then context matters. So assess the ground where you work. Thank you.
Absolutely. That is clearly a theme from panel one, as well as from what Bindi said too. Just know who you're targeting, understand the risks involved, and work with them to understand what the benefits may be, because they might be different than what you envisioned when in your air-conditioned office. Nima, yeah, Nima, I'd love to hear from you.
Thank you, Julia. On my side, I think after what Rachel said, any partner who wish to implement similar product or program like FAST, first of all, they have to make sure they develop a product to be simple and digital, but also to make it to tailor-made according to how the savings group are operating. Also, they're supposed to make their product to be more inclusive, as to make sure it be able to be accessible to both gender, be it male, female, age, all youth and the elder, also people with disability. Also, for the people who are going to be directly implementing the field, they are supposed to be local people so that they can be easy to gain trust from the people they are saving. Thank you.
Thank you. And I want to encourage all of our panelists, if you have any links to blogs, briefs, impact evaluations, I'm sure that the listeners still on, and those who've left but will be receiving a recording would be interested in a quick link to some of the topics we've talked about today. Thank you so much. This was a real pleasure, and you are all doing amazing work. And over to you, Dennis.
Thanks so much, Julia, and thanks everybody for joining our panel today. We've seen, you know, just so many different innovations, and there are so many more that we could have included today. So many more digital innovations, so many more tools and products that are out there. I want to encourage, like our panelists said, get in touch, find out who else is doing the work that you're interested in, and we need to continue to share and you know, cross collaborate. I encourage you all to reach out if you have any more questions. Reach out directly to Global Communities. Check out the DSG Hub, dsghub.org, to learn more about the digital solutions that are out there for savings groups. And we'd love to continue to be in touch. I also wanted to say thanks to our panelists for being on today. Really appreciate all your insights. Thanks to Julia and to Mabel, as well as the Global Communities team that helped to put this event on. Specifically Lizzie and Paula for all their work getting this together. And special thanks to our translator for helping us to have this available in French. The last thing I'll say is that we have some current and upcoming openings on the Gender Equality, Youth and Social Inclusion team here at Global Communities. So if you are interested, please do check out our website, globalcommunities.org, to see those opportunities and reach out if you are interested. Thank you again very much, and thank you to the NGO CSW Forum for allowing us to participate this year with this panel. And with that, I'll say goodbye.
Thanks everyone who stayed on until the end.